Now, the Welsh Government have released plans that could see free refills of sugary drinks banned. OK, now, this is an initiative to cut down on food and drinks with high fat, sugar, salt, to promote healthy choices. So what do you think? Let us know at home. Is it time for a legal limit on sugar?
Joining us now, writer and journalist Emma Wolfe and
the political commentator Nathaniel Ogunniyi. Good morning to both of you. Emma, I have a feeling I know where you're going to stand on this. You'll be absolutely in favour of restricting this. Tell us why.
Isabel, I don't think anybody needs free refills of drinks. We all know you get a large fizzy drink, whatever, with your meal, you take the kids out, maybe they have a pizza for a treat, maybe they have a, some kind of treat fizzy drink. They don't need free refills. Nobody does. The government in England implemented a sugar tax in 2018, or it was 2016 to 2018, and it had a real impact on children's sugar consumption in soft drinks and in fizzy drinks. It cut their sugar consumption by about 50% for children. And that's really significant. And look, I don't want a nanny state. I know that we don't want the government telling us what to do and telling us what we can and can't drink and eat. But actually, obesity is a huge issue. Obesity is the #1 health issue in this country. Let's be honest. 64% of adults are overweight or obese. 64%. And we know where the free refills movement comes from. America, right? Do you remember? You used to go there 10 years ago and you'd get endless coffee and endless frizzy refills of soda and all of that. And where does the obesity epidemic come from? Where America goes, we're following. 64% of adults, a quarter of 10 and 11-year-old children overweight or obese. So let's just be clear, obesity is the health crisis in this country, and that's what we need to tackle. I don't care whether it's nanny statism or not, we need to tackle it.
Nathaniel, you have your doubts about sugar taxes, don't you?
I do. And so I'm inclined to agree on the point that obesity is a major health crisis, but these measures don't fundamentally cut that. So it's good that we mentioned the sugar tax earlier, because the sugar tax was introduced and obesity in England has continued to go up, right? So we see that these nanny state measures don't work. So it's good that we're talking about this, but these measures fundamentally don't work.
No, let's be clear about that, Nathaniel. No, what we have found from that research is that sugar consumption in children was halved. It went down 50% as a result of that tax imposed from 2016. You might well have seen obesity going across the board from other things, but for the sugar intake was halved.
Yes, but so obesity is sort of about how big you are based on your calorie intake, but the intake from sugary drinks or indeed from free refills is actually quite low. And a good number of manufacturers changed their formulas for their drinks before the industry levy was brought in. So the tax didn't actually have all of that impact. And we could see that calorie consumption from sugary drinks was falling anyway. Between 2011 and 2016, calorie consumption from sugary drinks fell by about 5% anyway. So if it was falling, say, 5 years before the tax was introduced, then why are we suggesting that that impact is due to the tax? But more importantly, it's not just about sort of calories in versus calories out. We're talking about young children here. In Wales in particular, I think 50% of them don't meet the daily goal for activity levels. And that's a real shame, right? We need to get kids out playing football, playing rugby, being out with their friends. We know that's good for their focus. It's good for their attention. It's good for their behaviour in class. And it's good for their health.
Emma, well, the thing that amazes me is if the government knows that sugary drinks are bad for us anyway, why do they allow them to be sold? I mean, you could have this argument about cigarettes and the penalties that have been put on cigarettes, but we obviously still don't take it seriously enough, and the amount of sugary substances that is available for us to eat and eat as normal doesn't go down and isn't impugned in the shops. So why is that?
Well, just to slightly correct you on that, the amount of sugar has been reduced, and often they're replaced by sweeteners, artificial sweeteners, which we can also debate. They're not necessarily as good. You see very, very low-fat yogurts, for example, which are full of sweeteners. So often they'll remove things like fat or sugar and then they replace it with something else. So you make a really, really good point. But look, cereals, cakes, sweets, but cereals particularly are a huge source of sugar consumption for children, for young children. So I would absolutely agree. Reduce it down gradually across the board. We've seen this in recent years with the reduction of salt in ready meals, which has cut, heart attack, disease, stroke across the population. It does work. Intervention, I would totally disagree with, it does work. Whether or not you want the government to impose taxes or to tell us what to eat and drink. But I mean, when we have such obviously problematic levels of obesity, which, by the way, type 2 diabetes, cancer, heart disease, all of those things, hypertension, amputations, blindness, disability, depression, the list is endless. Why would we not want to help people? Why would we not want to encourage them to make healthier choices?
Nobody's mentioned teeth in all of this either. Sorry, Nathaniel, I'll just add one more thing to that list before. Obviously, you can make your response, but of course, I mean, the biggest cause of children going into hospital under the age of 5 is tooth-related. And Eddie Crouch, chair of the British Dental Association, said that the sugar tax was delivering tangible results and that extending it to the likes of cereals is, in his words, a no-brainer.
Exactly.
Yeah, but as we've established, sugar consumption was falling 5 years before we got a sugar tax anyway, right? So I think it's wrong to attribute those measures to the sugar tax. But as you've said, dental health is important. That's that's about toothbrushing, and that's about having a balanced and healthy diet. I'm not sure that free refills in a restaurant every so often is necessarily the biggest cause of that.
Sugar tax, yes or no, Nathaniel?
It's a no from me.
And Emma?
Absolutely, yes.
Okay, guys, thank you very much indeed.